Oh, thank you, Tara. But there were no questions from Tuesday night. So if there's something that you need clarification on or have a question about, please feel free to type that in the chat. Or if you need to unmute yourself and ask a question, you're welcome to do that. I want to reintroduce our presenters this evening. We have Joy Miller and Tara Solomon-Smith. Again, they are both Family and Consumer Science Extension agents with the Wildcat District and the Southwind District, and also Melanie Smith, who is the SHIT coordinator in our area and works for the Southeast Kansas Area Agency on Aging. So throughout the evening, if there's something that you guys have a question on, sorry about that, the chat box is ready and we will be monitoring that throughout the evening. So be sure and ask those questions, and we want to make sure and give you guys as much information as you need as you prepare to navigate Medicare. With that, I'm going to turn it over to Tara to get us started this evening.
Okay, good evening. Thank you. Good to be here again. Let me know if I start cutting in and out, and I'll turn my video off. So next slide, Julie, please. Thank you. So there's a couple of ways that you can decide to have your Medicare. And one of them is using Original Medicare, which we talked a lot about last week, or it feels like last week. On Tuesday, your Part A and B, and then you add some things to that, your drug plan, and then your supplemental. So you have your Original Medicare, and then you add things to it. The other option is called Medicare Advantage plans, also known as Part C. So that's where preferred provider groups, HMOs come in, and everything is combined. Instead of purchasing separately, it's combined. So next slide, please. So if you don't have other insurance besides Medicare, one option for you is to buy an insurance plan that works with your Original Medicare. And these are what's called Medicare Supplement or Medigap's, because they fill the gaps of help fill the gaps of what your out-of-pocket cost will be that Original Medicare Part A and B does not cover. And these have plans A through N, which is different than parts of Medicare A through D, just to confuse you, right? But we'll display those a little bit later. In most cases, medical providers bill Medicare directly, and then Medicare sends any remaining portion to the Medigap or your supplemental. And these can be used nationwide for any provider that treats Medicare and utilizes Medicare. You may have a portion to pay, such as a copay, a co-insurance, or a deductible. It does not, your Medigap / supplemental insurance does not cover prescription drugs, so you purchase that separately. And it does not include dental or vision benefits, which is why I sent out just a list of separate companies today as part of your resources. Next slide, please. So this chart comes to you from our our Insurance Shoppers Guide. You can find this online. We'll provide that resource. I also order copies every year, so I'd be happy to mail out a hard copy if you'd like. I find it very helpful. But these are those standardized Medicare supplemental options, those plans A through N that we talked about. C and F are marked out. Because after December of 2019, if you're becoming new to Medicare, you can no longer purchase those plans. So that's why I mark those out. But the other plans, the checks in those boxes tell you what they provide. And you can imagine that if there's less check marks in the boxes, your monthly premium could potentially be a little bit lower. Because the coverage isn't quite as all-inclusive. So you can find something that would meet your financial needs. Plan G is now kind of considered that Cadillac plan that covers the most. The only thing it doesn't cover is your Part B deductible, which is $198 for the year. And then D is the next one down. As you can see what it covers. There's not a ton of options to choose from with Plan D, but you can look at those. The next one would probably be Plan N. Very similar. One difference is there would be a $20 up to a $20 copay for a doctor's visit, an office visit, or a $50 copay for an ER visit, but then it would have a lower, potentially a lower monthly premium than those Plan Gs. So again, this is you can find this online. It's in the Insurance Shopper's Guide that we can also provide. Next slide, please. So when you think about buying a Medigap, here are a few things to consider. All Medigaps are standardized. That means the federal government decides what each plan, letter A through N, must cover. So as you can see on this slide, a company, Jones Company that sells Plan G, it can decide how much to charge you per month, but everything else has to be the same as Smith Company that's selling that same plan. Insurance companies may not charge the benefits. So if you're shopping for Medigap, as you decide where to buy, you might want to compare prices, customer service. If you can find it, you might look at how much premiums have gone up in the last 5 to 10 years. Just some things to think about. Next slide, please. So during your guaranteed issue, so that's 6 months of when you sign up for Medicare Part B, or within 60 to 63 days of losing your employer's or your credible insurance, this guaranteed issue time means that those insurance companies cannot ask you health questions other than if you smoke. And they can't charge you higher rates based on that. So we like to advise that, you shop around, do your homework, but purchase now as if you're 90. You can have the option. There's not an open enrollment period. You can call around and ask questions and look at other plans. But after this guaranteed issue time, they can ask you a full health screening. And so you're not guaranteed in to a different plan. If you're under age 65 and on Medicare due to a disability, you don't have this guaranteed issue until you turn 65. But you can still shop around and see if there's an insurance company that would supply you with a Medigap. Okay, and I think I'm ready for the next slide. You can find these companies that offer Medicare supplemental policies through the Kansas Insurance Department. We have the phone number and website listed there. And again, that shopper's guide that I talked about. But if you'll go to the next slide, it'll show the same link. It'll show you kind of what it looks like if you were to shop online. Next slide, please. So this is the online shopper's guide. Again, that website's listed. It asks your name, your gender, zip code, tobacco use, and then you select if you want Plan N, just to look at your options there. It'll list those and their annual prices. And then you can look at your Plan G or whatever it is you want to look at, and then research those companies a little bit individually. So with that, I think, don't forget to put questions in the chat box, and I'll turn it over to Joy for Part C, or Medicare Advantage.
All right, thanks, Tara. Okay, so Medicare Part C is the other way to supplement or fill in the gaps of your Medicare. So there's what's called Medicare Part C, and this is where a private insurance company replaces your Medicare, where it combines all the Medicare benefits together. So these are ran by private companies or private insurance companies. They are also often known as Medicare Advantage plans. So they go by many names. So sometimes they're also called Medicare Health Plans or Medicare Plus Choice. So you might see a variety of names. most commonly we hear them called Part Cs and Advantage plans around here. So if you join an Advantage plan, you still have Medicare, but you no longer have original Medicare. So instead, the federal government pays the Medicare Advantage plan to manage your care. So if you choose this option, don't throw away that red, white, and blue card. You just need to keep it in a safe place. Because if you leave an Advantage plan, you will need your original Medicare card, again, that red, white, and blue one. And to do comparisons during annual or open enrollment, you need the number on there to do the comparisons through Medicare.gov. So just keep that in mind. So the Medicare Advantage plan substitutes for original Medicare as long as you have the Advantage plan. And what this means is the plan decides how much you will pay and how much it will pay your doctors and resolves any problems you may have. So again, they decide what you will be paying. The Medicare plan must provide all the Medicare covered services. So it's going to cover, it may cover more, but it will not cover less than what original Medicare provides. So you may have different out-of-pocket costs with that. So you might have like a $20 copay to the doctor and maybe no deductible with that. But their costs cannot exceed what original Medicare would make you pay. And part of that's due to what's called the Affordable Health Care Act, also known as Obamacare. So please know that that Affordable Health Care Act puts some protections in here for Medicare participants too. So some Medicare Advantage plans may or may not cover the Part D drug plan. And so when you look at those, you just have to be careful and make sure you're choosing the right one for you. All right, next slide, please. Okay, so when you're looking at Advantage plans, they might come in a variety of ways. So we've heard of like the health maintenance organizations or HMOs. So some of the plans might be an HMO where you must establish care with a primary provider and use that plan's network. So, so again, having a primary provider coordinates all your care and the plan requires that you have referrals from that doctor to see specialists. So I call it HMOs, a mother may I go. PPOs also have a network of providers, but the plan will cover some costs if you see providers outside of the network. So you might see an in-network and an out-of-network variation in what you will pay in costs. So usually you pay more when you see an outside of the network provider. PPOs too, you will have a primary doctor, but you don't need to have a referral to see a specialist. You can choose who you wish. So the next one is a private fee for service. These plans let you see any provider who accepts Medicare and is willing to take your plan. So they don't necessarily have an in-network and out-of-network, it's just who will be willing to accept your plan. So like I said, they don't have a contract. So providers can change their minds at any time or visit to visit whether they will accept this coverage. So while you might confirm that they'll take it when you enroll into the plan, it may be mid-year of the next year they decide they don't want to do that, and there's nothing you can do to change that. So just so you know, they can change their whether they want to or not. So for all plans, you just want to ask about any limits. You want to make sure you're seeing specialists and providers within your network and just learn all the rules before you sign up. So, all right, Julie, next slide. Next one. All right, so who can join an Advantage plan? to join an Advantage plan, you must have both parts A and B. So you can't, and supplements are the same way. You have to have both parts A and B. The other thing is you must live in that plan service area. So again, when you're deciding going on to Medicare.gov, you'll put in your zip code and you can see what plans are available to you. If you have received your Medicare New book, the Kansas version, it will have all of the Part D drug plans and the Medicare Advantage plans listed in the very back. Just because it's listed in the back and it's available in Kansas does not mean, for Advantage plans anyway, that that is available to you. So specifically, like Kansas City area might have some different plans, or out west. So one we do not have, I'll just talk about Bourbon specifically, is we do not have United Healthcare Advantage plans or the Blue Cross Blue Shield Advantage plans available to us. I've also seen in our district, the first year we had Woodson in our district, they had one Humana plan available, but we had several others that were different in Bourbon County. So it is a county by county scenario, which plans can sell to you in which zip code. So be careful you sign up for one that is right. You cannot join a Medicare or Advantage plan if you have end-stage renal disease. So you are not eligible for that with that. You are guaranteed issuance no matter when you join an Advantage plan. So every year you have the opportunity to enroll in that. So let's just say you started with a supplement and you get several years down the road, you may decide that you want to do an Advantage plan. You will always be guaranteed issue into an Advantage plan, just so you know that. Okay, next slide. So what might an Advantage plan cost? Remember, these are the premiums to have an Advantage plan. You still have to pay the Part B $144 a month premium with Part B. So add that to this number. So when I looked at Bourbon County's, again, Advantage plans, they ranged from $0 a month to $99 a month. Deductibles, again, ranged from $0 to $1,000 per year. And when I look at maximum out-of-pockets, the in-networks ranged from $3,500 to $6,700, and out-of-network ranged from $6,700 to $10,000. And so that is per person. When you think about Medicare, there is no group or family plans, such as when you have like a family health insurance plan like through your employer. So just know that if you are a couple, you will have your own policy and your own deductibles to meet, and so will your spouse. So just so you know, this is per person. There's no group discount or contribution together. So next slide. All right, so as I said earlier, you will pay for your Medicare Part B premiums, your Part A, if there is any, if it happens to be, you need to do that, and you will pay for the Medicare Advantage plan monthly premium. So those are what you have to pay per month to have the plan. And then as you use the plan, you will pay deductibles and co-pays. One thing to note, even though there's a maximum out of pocket and there's co-insurance, if this has a Part D drug plan, it will operate like or very similar to if you have a Part D separate, like with a supplement. So you will still have, there might be a drug plan deductible that's just for the drugs, but you will still potentially go into that donut hole. So it doesn't necessarily operate where if I hit a maximum amount, that's where my drug costs end. They kind of operate a little separately in that aspect. So The only time you can get a Part D drug plan separate from a Medicare Advantage plan if it is a private fee-for-service plan. So that's something to look at. Not all Advantage plans have a drug plan with it. And if it does not have one, you cannot automatically just get one. It must be a private fee-for-service to have that separate policy. So again, Advantage plans typically are fairly low cost on the front side, meaning the premium side. You can find nice plans that are $0 a month. You will pay a heftier price or potentially more in the end when you use that policy. So that is something to weigh out. That is a annual, so it always runs from January to December, and then you start over. So I always say that's something you have to consider is, do I have $6,000 in my savings account to cover if I'm hospitalized and those kinds of things. So can you afford to possibly pay that maybe 2 to 3 times in your lifetime? So just something to kind of think about with that. Again, to see estimate costs and what plans are available, some of the details, you want to go to medicare.gov. So the other reason Advantage plans may be enticing is some of them do provide some dental and vision benefits. So again, you have to weigh those options out. Is there enough benefit for me with those? But those are part of the other extra benefits. There is even more benefits being added to those, but you may have to qualify under some special circumstances, like with a chronic health condition, or is that service provided in our area? So I know they've been advertising meals and transportation, but in our rural areas, I don't know if we are exactly set up for all of that pieces. Some of them will offer benefits like silver sneakers. So again, you just have to weigh out the advantages and the costs of being in those programs. So next slide. Okay, so Melanie is going to talk about getting help for paying for Medicare.
Okay, can you hear me? Oh, well,
Yes.
okay. So what it is to get help with your Medicare cost, there is 2 different plans that help with that. And one of them is called Medicare Savings Plan. And that plan helps you with your Part A, Part B premiums in help covering those costs. Now, a lot of people don't have Part A premiums, so that wouldn't be a help that way. You're not having to pay for it. Everybody else will have Part B premiums. And so this program helps to pick up that cost, the $144 that you have every month. Also, if you qualify for one of the programs, QMB, you can get help with some additional things besides your premium. You can get help with your deductibles, co-insurance, and that's very, very helpful for people that qualify for that. It basically acts like a supplemental policy. It picks up everything that your Medicare doesn't, it picks up the other 20% that Medicare doesn't cover. Now, the starting point in incomes and assets to qualify for this Medicare savings plan, for a single, your income would need to be gross income a month at $1,436 or below. So, and then your assets would need to be at $7,860 to qualify. And when I mean assets, when I mention that, that's like the balance in your checking account, the CDs you would have, cash value of life insurance policies, any stocks or bonds. We look at all those things and find out what their value is. And if it's under $7,860 and your income is under the 1,000 or at the 1,436, you could be eligible, more than likely eligible, to get help with your Medicare premium. Now, I want to just make this point too. Every year, these income guidelines and the asset guidelines change. And so these figures just came out this month. So you might have been familiar, seen this pamphlet, this brochure, and it had lower figures. And I just wanted to be sure that everybody knew these are the most recent income guidelines and asset guidelines. It changes about May every year. So this is the current amount for those programs. And so if maybe you were, you know, under it before, or you know somebody that maybe tried and didn't qualify, just encourage them to try again, because these plan guidelines have changed. Now, as far as couples, I was going to go back to that slide. As far as couples, your gross income for both of you has to be at $1,940 a month, and your assets can't be over $11,800. So we just look at the gross income, not your net, but your gross income, and that's how that's based. Next slide, please. And I want to this is where you would go to get help with that, is CanCare Clearinghouse. And also SHIC volunteers, the SHIC counselors, can also help you apply for that program. One or either way, you can get an application and we'll help you apply for that program. And I kind of wanted to visit a little bit about the QMB program. If your income is under, as a single, 1,063, as married 1,437, then you would qualify for what's called the QMB program. And that helps with your Medicare Part A, Part B premiums. It helps with your yearly deductible, that $198 annual deductible. It helps pay that, as well as just any co-insurance you would have. Once Medicare pays anything that's remaining, this plan would help pick up, and it's as long as it was an expense that Medicare didn't cover. So that's something that's really a help. And when people have qualify for that, they don't need to get a supplemental insurance policy. Basically, their costs are going to be covered. Next slide, please. Now for Part D, extra help, that's your prescription drug plan. You can get help with those as well. And that is a different program that's called sometimes Low Income Subsidy, LIS, and it's done through Social Security. So Social Security monitors this. They take the applications for it, and it has a different set of guidelines to qualify for it. And those are listed below. Your income for a single to qualify for this plan, your gross income a month has to be at $1,595 a month or less. Your assets can't be over $14,610. And then as a couple, you qualify when your income, gross income, is $2,155 a month and your assets are at $29,160 or less. Now, what this program helps with is it'll help on your Part D premium. It also helps with your prescription deductibles and copays. Depending on your income, you will qualify for different rates of help. Some people get on the low end, when their income is very low, they get help with the total Part D premium. Others, if they have more income, they might pay a partial premium. So it varies, the help you get, all based on your income. And what happens too is when you have this coverage, the extra help coverage as well as the Medicare savings that I just have explained to you, it'll help with penalties that have been applied to your premium. So if you have a penalty and it's added on top of your Medicare premium and you have one added on your Part D premium, this extra help will help pick up those penalties. In some cases, it will, when you're in the lower income brackets, it'll totally eliminate them. Sometimes in the higher, it will definitely reduce your cost of your premiums. It may not totally eliminate your premium. So these are both excellent programs to check into if you are under the guidelines, and just really an advantage, especially the Part D is very helpful for people that have a lot of prescriptions sometimes that their costs are just a burden every month for that Medicare beneficiary. Next slide, please. And this is who you would contact, Social Security Administration. That phone number as well as online. And a lot of times Social Security just automatically contacts you. I have a lot of people that come to my office and they've gotten a letter from Social Security saying that they might qualify for extra help. And they'll send those out when people's incomes are in the guidelines that qualify them for that program. So a lot of people are contacted by Social Security and asked to check into it. And so you can come to our office, or even like this says, go directly to Social Security to check out that program. Okay, next slide. And the next thing I wanted to discuss is Medicaid. A lot of people, Medicaid can be confusing. It's kind of hard to understand. And I just kind of wanted to give you an overview of when people can qualify for it. You have a lot of people that once they get Medicare, it's going to be very hard to qualify for Medicaid. That's just kind of a, unless you're in certain situations, but if you're just in your home and you're not getting any kind of special services, more than likely you won't qualify for Medicaid. And so here's some of the criteria. If you are single, your assets can't be over $2,000. You can't have more in your bank account than $2,000. You can't have a savings account that's over $2,000. Life insurance matters, the face value on life insurance. You can't have additional properties that have a value to them. So there's just a lot of things that are considered. So you have to have your assets and at $2,000. That's not your income. That's your assets that you have, can't be over $2,000. For married couples, they can't have over $3,000 in assets. Now, if a person's income is under $465, let's say a single person is only getting Social Security and they only get $465 a month, that's the gross amount, they would automatically qualify. But a lot of people, that's very, very low income. And so, most people are above that. And so what would happen is they would have to meet a spin down to be able to get Medicaid. And I'll explain that on the next slide. Okay. So here we have somebody whose income is over $465. Their resources are fine. They don't have a lot of money, additional money in checking or savings or in like CDs, anything like that. And so for a person to qualify for Medicaid, they have to meet a spin down, okay? And what the best scenario of explaining what a spin down is, it's like an insurance deductible. You have to spend so much in medical expenses before Medicaid will start paying. So, and the spin down is based on your income. The state of Kansas has a formula they figure on how to figure out what you would have to pay in a spin down, and it's all based on your income. And they use it, they base it on a 6-month period. And so they have these calculations that they run to figure out what you would have to pay to meet a Medicaid spin down. And So let's say you've applied for this medical program, which is called medically needy, that you feel like you're going to have enough expenses to meet a spend down. And so you apply for this medically needy program, and they'll send you a medical card. And anytime you go to an office visit, doctor's visit, you have a procedure done, you're going to give them that card to just let the state know. They'll run that card and show them this is what your expense is. And that way the state knows to say, well, she spent this much so far, she spent this much so far. And then when you meet that deductible, then they will Medicaid will start picking up your expenses. Now, when you have your Medicare, and we can go to that next slide, when you have Medicare, it's going to be harder to meet a spend down because Medicare is picking up a lot of your medical expenses. And especially if you have Medicare and a supplemental policy, more than you just won't meet the criteria to meet a spend down to get Medicaid, because all your Medicare's paying 80%, Medicaid's paying 20, or your supplement's paying 20%, and there's not a lot of things left over usually that's not met. That is an additional expense, so you wouldn't be able to meet that deductible to get the Medicaid. And like I'd mentioned earlier, people that are the QMB beneficiaries, they're having all their stuff met too. Basically, all of their stuff's being paid for, so they wouldn't need a spend down. I'll give you a couple of examples when a person can meet a spend down. It's people that have Medicare only. And I knew a woman that she was Medicare only, and it's because she didn't have the income for a supplement, and just low income period. And she had gone to the doctor and found out she had cancer. Well, she was going to have astronomical chemo bills. Chemo's exorbitant in what it cost. And even with Medicare paying, its percent, there was still so much more in expenses that she was going to have to meet. And so, I told her you need to try for Medicaid, and she was able to meet her spend down in a month. That's just how much your chemo bills are, in the thousands. And you could more than likely, when you're low income, you're going to meet that within a month, if not within 2 months, and you could be eligible for the Medicaid. So mostly when people, we just recommend if you only have Medicare, it's great when you have a supplement. That's the best way to go. But for people that just feel like they're going to run into a medical situation, or they have an unexpected medical situation come up, that's when, and they only have Medicare, that's when it's best to, try then to see if you can qualify for Medicaid. Next slide, please. Okay, so the volunteers, the one right before that, volunteer slide, we just want you to know that we have volunteers, we have SHIC counselors in the area to help you with your Medicare process. We'd love to help you along the way, just to visit with you and see if you kind of have it figured out and you feel comfortable. And just any questions you would have, we're more than happy to help you with supplemental questions, just kind of the basic 101 like we talked about with Medicare. And everybody does have a different scenario. And so you just can't go by your neighbor's scenario or even somebody at your work. You need to know for yourself through somebody that's knowledgeable of Medicare if you're taking the right path, if you're understanding everything, because everybody's situation is different. And we just love to help you. And so what we do is, like, there's Julie, and there's Tara, and there's Joy. But we have other counselors in the area, and we like to connect you to somebody in your own county. And so if you call the 620-431-2980. I'd be happy. That'll reach me, and I'd be happy to get you to somebody that's close to you, or even welcome if you're in the Chanute area to come in and visit with me. So we really just want to help you in this process. And then the next slide. Here's this resource link information again. And this is what we have discussed in this presentation so far. And we also have that as a attachment that as a handout that you can get. So we just wanted you to know that that's available with the handouts under the new to Medicare checklist. We've listed those there. Also, the information I shared on the extra help, that is an attachment as a handout for this series that we've discussed this session, so that you can have those figures in front of you and see if that's something that you know somebody who might be helped by that, or even if it could be helpful to you. And I'm going to turn it over to Tara or Julie to help you next.
Okay, yes, it's me again. I do have an evaluation again for this evening. If you have an iPhone and place your camera over that QR code, a link will pop up and you can go directly to our survey. I'm also going to put that link in the chat box as I get it copied here. We do go ahead and would love to have you type any questions or unmute and ask us a question if you'd like. Feel free to email us as well if you don't feel comfortable visiting this evening. So I did type in that link for our survey, so you can copy that and place it in a browser if you weren't able to get the QR code to work. And that's all I have. I think our next slide shows a little bit about, we have a newsletter. Each of our offices does some form of newsletter. This is a small email or text where you can get a soundbite of information once a week from us. So just promoting that again. And then there's our contact information with questions. Thank you. Joy or Julie, do you have anything else?
I don't have anything else to add, but just thank you for joining us tonight. And again, if we can help you in any way with your personal questions or situation, please do reach out.
I agree. Thank you for attending, and I'm really looking forward to, I feel like I've learned a lot, girls, just through this seminar, so I'm looking forward to becoming a SHIT counselor here in the future. It doesn't look like we have any other questions.
Can I ask a question?
Sure.
I'm currently working, and so I'll turn 65 this year, but I work at the Neosho County Community College. So I'm going to continue working. Is there anything I would have to do when I turn 65 for Medicare, or do I just wait until I am getting ready to quit the job and at that time?
You can wait until you quit the job. I just always do recommend that people go in and talk to weigh out, to see both pictures financially is what I say. If you were to just stay on your current employer plan, what it would be like if you did your employer plan plus even just Medicare A and B, and then what would it look like if you transition to Medicare A and B, and however else you want to, what other parts you want to add. So I just encourage that you have all three scenarios looked at before you miss that opportunity, and then your next opportunity will be when you decide to end your employer insurance and move on into Medicare. So sometimes that's also helpful for some to kind of have a grasp of what to expect when you do leave your employer insurance, so you're prepared mentally for those changes moving in and feel comfortable. So that's just my personal advice, is to kind of look at all the scenarios, and then you make the decision that's most comfortable for you moving forward.
And should I do that with my HR person, or do I?
You can, or you can call. So Melanie's in Chanute specifically. I oversee Neosho too, so you can meet with a SHIT counselor to do that too. So maybe your human resource person is comfortable, but that's something I help people with all the time, is just evaluating what are their options, even though they can continue to choose to work and have employer insurance. So.
Okay. And I should do that within the 3 months before or 3 months after I turn 65.
Yeah. Sometime in that initial enrollment. Yes.
Okay. Thank you.
You're
The
welcome.
other thing I might mention is just the one thing to be sure of is about a health savings account. You have to follow certain rules that way. When you go to get Medicare, you can't have a health savings account and have Medicare. Do you have a health savings account?
No.
Okay,
No.
you're fine then. Yeah.
Yeah.
That takes some more negotiating and getting your Medicare. So.
Okay. Well, thank you very much. I appreciate all the information you gave us. Thank you.
You're welcome.
Any other questions? Well, with that, I would like to thank you guys again for participating in the New to Medicare series. Please feel free, or please be encouraged to fill out the evaluations, and we have recorded both of these sessions. So if this is something that you feel like someone else, a friend or someone could use this information, please get a hold of us, because we can share these videos after this evening as well. You guys have a good night.